Hello and welcome to another Fikava Vet Chat. As the year is coming to an end, we are all over Europe expecting that there will be a fair amount of fireworks. They can be a considerable reason for concern for our pets. And tonight I would like to speak to an outstanding behaviorist about what we as veterinary professionals and also what pet owners sort of can do to deal with firework anxiety. The person I would like to speak to tonight has studied veterinary medicine in Lisbon. He then got a master's in clinical ethology and animal welfare from the University in Madrid. He got then a PhD in veterinary science in Oporto. He is a diplomate of the European College of Animal Welfare and Behavioral Medicine. And he currently works as a director of the Center of Animal Knowledge and is also a professor of animal welfare, behavior and training at the University or the Polytechnic Institute of Porto Alegre in Portugal. In addition to this, he is a very often sought after lecturer. He is a popular behaviorist, animal trainer and sought after speaker at official or public events. He has published several scientific studies on animal behavior and welfare. He's also the founder and past president of the Portuguese Association of Behavioral Therapy and Animal Welfare. And he is the president of the European College of Animal Welfare and the vice president of the European Society of Veterinary Clinical Ethology. I don't think you will find anybody who is more qualified speaking to us tonight. So hello and welcome to Gonçalo Da Graça Pereira from Portugal. Hello, Gonçalo.
Thank you very much. Hello, Wolfgang. Thank you.
What I forgot to say in my introduction is that you're also an outstanding communicator and always somebody I like to speak to because, as I said, it's so easy to talk to you, and you are very down to earth despite of all your qualifications. You always have a practical approach, and I, as a first opinion of a practitioner, I like to speak to people like you.
Thank you very much, Wolfgang. And the first thing that I would like to say is that a part of everything you said, well, my name is only Gonçalo. I'm a colleague and I'm here just to support everybody that needs and with what I know, because I don't know everything, Wolfgang. So I'm just here just to give the best of me, as I always do.
So what we want to talk about tonight is firework anxiety or phobia, or is that the right term we should use, or how would you prefer to call it? Is that correct, or do I mix things into each other? Sorry, I'm just a humble first opinion veterinary practitioner.
Don't worry. So the point here, I like to call it noise reactivity. One colleague, Kirsty Saxel from Australia, she calls noise issues because in fact, there are different issues, and there are from fear to phobia, there are anxiety. And what are the main differences that we have between all these three terms? The first one is fear, and fear is something normal. All of us needs fear because it's the only way for us to survive. The other one is the phobia, which is an excessive fear that the person or the animal lose the control and cannot control him or herself. and it's totally difficult to control and to realize and to copy with the environment. Okay, so it's difficult to stop. And the third situation that you also mentioned is anxiety. And anxiety is like physiologically is like a stress response. So in terms of physiology, the body is giving the stress response. However, what makes the difference is the anticipation, and the anticipation can be the anticipation of a fear that could be real, imaginary, or something that is in the animal mind. So this is what makes difference, is the anticipation. Let's go to give some silly examples, because I always like to give examples to make it clear. So let's talk about spiders. Some of us do not like spiders, but so let's say that Wolfgang, you have fear of spiders. So if I tell you, Wolfgang, look this gorgeous spider that you have over there in your wall. You look and you say, oh, there's a spider there, and you move over here, and time to time you look over there. So this is normal because you have fear. So you look over there, okay, so she's there, I'm here. However, if you have a phobia of spiders, when I said Wolfgang, have you seen the beautiful spider you have over there? You move immediately away from the camera. So I see you no more. You disappear. So this is the phobia. Okay.
Just hear the word, and that's it.
Discontrolled. And anxiety. Let's say that you are the famous cartoon that is normally with fear of the wolf and taking the little cookies to the granny. Okay, so fear is normal. So you go to the forest and you start, you listen to noise and you look, oh, it's not the wolf. So you continue. And then another noise, and this is normal fear. But if you are suffering from anxiety, you are at home already suffering, imagining that the wolf is already in the forest, okay? And when you go to the forest, you are already where the wolf is. So this is an anxious animal. So what makes the difference is the anticipation. Yeah, was this clear?
Just going back to the terminology, you talk about noise reactivity, but can we boil it just down to noise? Going out from that, what I sometimes hear from some of my clients is that even in older dogs that sometimes have difficulties with the hearing, the noise don't seem to be so much the issue. It is sometimes the light flashes. So the sudden light that is sort of flashing outside, and they might not hear very much, but they get very, very much stressed by that as well.
Indeed. So in fact, Wolfgang, in terms of reports and published studies that we can find in literature, one of the main cause is noise. So the most reported is canine and feline noise phobias, let's say, like these noise reactivity. However, in a first situation, what the animal learns is the stimuli that is bigger and more threatening to the animal. However, there are other signs around, and one of them you already mentioned, which are the lights. So before getting deaf, the animal had a fear, for instance, of fireworks, thunderstorms, okay? And then he starts associating the lights with the noise. And once they do not listen anymore, the lights continue there. So they associate the lights with the fear that they had in the past.
Yeah. Oh, yeah, that makes sense. Yeah, yeah, yeah. So let's have a look. What can we do? I mean, we are still sort of a little bit away from New Year's Eve. What can we do now if clients get in touch with us? What suggestions would you have?
So, Wolfgang, the first suggestion that I always like to highlight is never ever ignore an owner that mentioned that his or her dog has a fear. Okay, because a fear can move from one stage to the other. Okay, let's say I usually split it in two stages for help us in our diagnose. Okay, let's say that in stage one we have a dog that is fearful only during noise exposure. Okay, and during this situation the dog hides from the fear that inducing events. Okay, but during these moments the dog is able to control his own behavior, and despite he is in a negative emotional state, he's engaging and finding a coping strategy. Okay, he's hiding, and if the owner respect this situation, but understanding means that we can treat and support the animal to solve his problem. However, the problem is that many times when we ignore this behavior, the animal goes from stage one to stage two. And on stage two, it's when the fear becomes much more severe, and there are predicting or avoiding strategies that are already failing, and these can lead to very, very severe situations and complications like generalization, as we spoke, with predictive cues. Different contexts could be associated with the house or the outside, or so associative learning, as we've been speaking. Okay, and this is something very important to support us to make a clear diagnosis.
Mm-hmm. But again, to my question, if we are confronted with this situation, client comes to us, says, "Here, our dog goes crazy at New Year's Eve. What can we do now? We still have 2-3 weeks to go. What would be the suggestions you would have, the steps we can take now to prepare the dog or the cat in that?"
Okay. So in these situations, first of all, if it is a low fear and not a very severe situation, so we will concentrate in what we call management. And the main the aim of the management is to assist the dog in developing coping strategies. And it means that we are going to manage the environment and make some changes in the human interactions. Obviously, that together with these, we can support using pheromonal therapies, nutraceutics, and sometimes appropriate medication that we can speak later on. Okay, so when we're talking about environmental management, the first rule is to provide suitable and accessible hideouts. It's very, very, very important to make sure that the animal knows the location and has totally access to this location. So And typical places where they like to hide out is like bathrooms or cupboards or under the bed, because they feel more comfortable, because they do not listen, they do not see. Okay, so the sound level is lower and the dog is feeling better, the dog or the cat. So it's very, very important to provide hidey holes. Okay, very, very important. If we have time enough, we can train the dog or the cat to a crate or a place that he feels safe. Sorry.
Yeah. That's also what I often recommend to my clients, to have a if they have a cage or a crate, as you pointed out, then to reduce the noise level also by covering it, also making a sort of den out of it, covering with 2 or 3 layered blankets,
Yes,
also
exactly.
to absorb sound, and then to have it a normal routine, sort of to have the animal sort of going into that place, or
Exactly.
that is part of the routine in the evening, that the dog or the cat
Definitely,
goes there where
definitely,
they feel
definitely,
comfortable.
definitely. This spot should be a place where the animal feels totally comfortable and is the safe area. So blankets could be very useful because they create the cozy environment for the animal as well, where they can hide inside the blankets as well. This is something very nice indeed.
How about noise desensitization? We had, over the years, we were often, or we have been providing clients with sound CDs, Firework
Mm-hmm,
CD,
mm-hmm, mm-hmm.
which we then suggested to play first at a very, very low noise
Yeah.
level, and then to racket it a little bit up. What's your
Yes.
take on that?
Okay, okay. So thinking first of all on music and sounds, we can use music and sounds sometimes to block out the noise from outside the house. Okay, so sometimes, but this is different from what you're mentioning. Okay, I'm just giving another tip, which is using a background music inside the house or white noise inside the house to block the exterior. What you're mentioning is what we call desensitization together with counter conditioning. These are the 2 words that we are talking about. And when we're doing a desensitization program, is exactly what you said. So you can put a CD with the sound of the fireworks, with the very low intensity, and careful, because it must not make any type of reaction in the animal. Otherwise, you're not doing a desensitization.
You're making right, we're doing right the opposite what we want. So we might actually add to the anxiety. Really, I mean,
Exactly.
I agree. So yes, yeah, might actually make things worse if it's not done carefully.
Carefully. So very, very low, okay? And together with that, you can start giving some positive reinforcement at the same time, okay? And then you start putting the noise a bit louder, but very slowly, very slowly, very slowly, and always paying more and more and more and more, and having different types of reinforcers as well. You can have a jackpot when the sound is so high that you need to pay more to the dog or the cat, okay? And this is also very important. So, but always starting and make sure that you are not producing any type of reaction. And this is very, very important. During this training, the owner is the main role. The owner should be very relaxed and comfortable. Remember that especially dogs, before reacting, they look to the owner. Okay, so they look to the owner emotion. So it's very important that the owner plays the role model and shows the dog that there's no reason to be stressed. Okay,
That's important. And I think that's quite important, that as an owner, on one hand, yes, you are aware of the stress the dog or cat has, but I think it's a wrong reaction then to further enhance it by fussing with the dog or the cat. I mean, reassure that you are there, but then continue with normal things, and don't be yourself sort of sidetracked by the sound or by the flashing lights or something like that.
Yeah,
So
yeah.
be an island of calm yourself, really. So
Exactly,
that would help.
exactly, exactly,
Yep.
exactly.
Yep.
You can whistle, you can sing, you can play a game, showing that you're calm enough. So there's nothing to worry about. Okay, but another thing that I heard many times people to say is to ignore the fear of your dog, ignore the fear, and this is something that we should never do, because most of the times what people in the past were saying was that when we were looking to the dog and supporting the dog or the cat, we were reinforcing fear. And what we currently know is that fear is not reinforced. So we are not reinforcing a negative emotion. Okay, so if the dog or the cat are showing fear, what you need to do is to redirect this fear and ask the dog to do something that is good. So let's play, let's have a game together, let's relax and move from a negative emotion to a positive emotion. So never ignore an animal that is in a fear situation. And obviously that's on cats. This is much more difficult because cats are much more subtle, and usually a fearful cat, they simply hide, and the owners do not understand that the cat is in a fearful situation, which is more difficult.
We talked about light earlier. So what I tend to recommend to my clients is, if anything, to possibly up the light level in the flat, but to use curtains whenever possible. Ideally, sort of, if they have sound, there are also special sound absorbing curtains, or curtains that are really good to keep light completely out. So this combination of drawing the curtains or the blinds, and at the same time increase the light inside the house, so that these flashes are not sort of, that they don't play, well, such a important role, or that the contrast is not too big.
Indeed, indeed,
You would
indeed.
agree with that?
Yes, yes, indeed, indeed,
Mm.
and closing the windows, closing the curtains is something very very important. And once again, going back to the sounds, when we are doing a desensitization, sometimes it's not. We don't see also some results because the way that the sound comes out from from our CD players, for instance, is not exactly the same type of waves that comes from the thunder, okay, or from the fireworks. So this is one reason why sometimes it's difficult. And another reason, which doesn't happen in fireworks, it's the differences that we find in the atmosphere pressure, okay? And we know that when there is a thunderstorm, there are changes in the atmosphere pressure, and this is something that we cannot control when we are doing the training. So that's one of the reasons why it is so difficult to work with animals that are suffering of this specific disease. And there comes the medication that we would need for these situations as well.
Yeah. Talking about which, or not quite, we are not quite there, but we mentioned pheromones. So a feline canine artificial pheromones. What's your take on that?
Oh, my opinion is that pheromones are very, very good indeed, and the studies showed the results. Okay, so it's not my opinion; it's the opinion of researchers. It's the opinion that are fully published in literature. The only point is that, for the sellers of pheromones, they know how much I love pheromones. The only problem is that I don't like the vets to sell the pheromones or the owners to buy the pheromones, thinking that the pheromones will be the solution. And the same happens with medication. Medication is not the solution, it's part of the behavior treatment. And this is one severe problem because most of the times, Wolfgang, when a case is referred to me, the owner already tried the pheromones. And when I mention pheromones, they usually say, oh, I've already used and it did nothing at all. And the point is, there are no miracles in behavior. So there are no magical pill to solve a behavioral problem. It's not an antibiotic. It's not something that you give and you treat. So the medication is just part of the treatment, as pheromones are part of the treatment as well.
Some owners, especially some dog owners, use anxiety or fear jackets. What do you think about that? So some, I don't know, do you have any experience with that?
I'm not going to say the number, the name of these, because nobody is paying us to say the name, but I know exactly the brand that you're mentioning. And there are some evidences that, in fact, with some dogs, the feeling of being a bit more restricted help them to calm down. So obviously that brand that you know and we both know is already prepared, and it's easy to put and wrap the dog. But if you use another type of wrap, it can work as well, okay? But carefully, because in some dogs it could be also another reason to be more anxious, okay? So you need to get the dog or the cat used to this before. It's not, oh, there's a thunderstorm, so I'm going to wrap my dog. And this is another sign that something serious is coming.
Oh, yeah, so, it's very different. Yeah. Herbal treatments. I'm often asked about that. I personally, I mean, we know there are supplements that contain L-tryptophan or valerian, for example. So these are not prescribable medication. These are freely available supplements. Are they of any help? Do you think there's a difference between dogs and cats when it comes to these supplements?
Okay, when we're speaking about supplements, the supplements that usually we're giving are those that are precursors of neurotransmitters. And usually what we are trying to do is to increase the level, for instance, of serotonin, okay? So, and in these situations, if you increase the level of serotonin, the mood of the animal is more relaxed, okay? However, what is happening in many of the situations is that the problem is that the number of receptors in the postsynaptic space is higher, then you need to use medication and proper medication. And sometimes in those situations, you need also GABAergic medication as well. which acts different from some of these medications. However, if you go supplementation, sorry, if you go to, for instance, alpha-casazepine, it works more or less in the same way as a GABAergic, which means that will have a calmer effect in the animal. However, if you're going to use these supplements, I always recommend to start some days before the events, okay? Even if you go to other medication, I always recommend to start before. There are drugs for SOS situations as well, but those are acting in a totally different way from those that we are mentioning here. I'm sorry about my dog is barking.
Well, yeah, obviously then there's a medical intervention. Obviously for legal reasons, I don't think that we can go too much into dosages and a specific medication. So that is certainly, I can just refer them to the literature here. And again, there's some medication that can and should be started possibly a couple of days in advance, if not even longer. And then there is the emergency medication that you can theoretically sort of give on the day. So a range of different sedatives predominantly.
I usually say that medication is appropriate if generalization is wide and there are complications in with the animal. If the welfare is affected and the exposure to a fear-inducing event may cause a relapse or a worsening of the behavioral conditioning, and for instance, in when there are cognitive dysfunction as well, it can be very, very, very useful. Okay, but careful, because there are some medications that can exacerbate rather than ameliorate fear, which continue to be widely prescribed. As you said, we cannot talk about specific names, but for those vets interested in know more about types of medication and what should not prescribe, obviously we are here, and the SVC also has a specific position statement on this specific drug that I cannot say the name, okay? But we should not use some drugs, but we can use others. But the vets know what to use. So for the owners that are seeing these, please talk with your vets.
One thing that I forgot to mention, earplugs. We have in the UK, we are often recommending to clients that they use, we have these carrot-shaped earplugs for the people use on shooting ranges. And I find they fit very nicely into the external ear canal of dogs. Do you like them?
Yeah, indeed. Sometimes I use the earplugs. Sometimes I use a kind of headphones, okay? Or if the visual stimuli is also problematic, we can also train the dog to hide the eyes, okay? So there are several ways that we can train the dogs. Obviously that we need a certified dog or cat trainer to do this type of training, because otherwise you are sensitizing the animal, and every time that they see you coming with the earplug, they run away from you, and that's not the goal. Okay, so the goal should be train the dog to enjoy the earplug. Usually I say that training this type of utensils, these type of tools is like training children to wear shoes, because our feet were ready to be always bare feet. I love to be bare feet, so for me I would always be bare feet. However, somebody realized that, well, we should have shoes, so now we are choosing shoes that are comfortable, shoes that we like the style. Obviously that for dogs style is not an important issue, so what matters is the comfort and the way that you introduce this new tool. Okay, so there's a procedure, a clear procedure that habilitated and certified animal trainer would help the owner, and every vet should have an animal trainer working with him.
Yeah. Ficava has, with you as one of the main authors, produced a fact sheet on firework strategies, what to do with pets. So these fact sheets are now available on the Ficava website, and also they can be downloaded from there. There will also be highlighted, obviously, on the other social media channels. If you have any questions or any comments about this episode of Ficava Vet Chat, then you can get in touch with us by emailing us on vetchat@ficava.org. Gonçalo, thank you very much for all the information tonight.
It was my pleasure. Yeah.
It was great speaking to you. And as I said, it's always nice having a conversation with you. There are so many other behavioral issues we are confronted with as veterinarians. So it would be great if we maybe could that more regular feature that we get you or one of your colleagues in again and talk another important current issue. So it would be great if we maybe could work towards that.
Yeah, that would be really great indeed, because I think that it's our duty as vets to support, first of all, each other's, and then support the animal owners as well. So we are here to support everybody, especially the animals that are under our duties. Thank you very much, Wolfgang.
Perfect. Thank you very much, and goodbye, Gonçalo.
Bye. Thank you.